Welcome back to the Heal Your Hormones podcast. I'm your host, Dr. Danielle, and today I wanted to talk about a topic that is a very sensitive subject, but I think it is really important to talk about, and that is what to do after a miscarriage. Now, I'm going to preface this by saying I have never experienced a miscarriage. I have never been pregnant. My experience with miscarriages is through the eyes of the women I get to work with and support. Miscarriages are very common, and miscarriages are the spontaneous end of a pregnancy and loss of a fetus that occurs before the 20th week of gestation. Now, about 80% of miscarriages happen in the first trimester, so less than 12 weeks, and most occur during that week 6 to 8. Now, roughly 10 to 25% of pregnancies end in miscarriage. The exact number is unknown for a few reasons. For one, some women will become pregnant and miscarry before they realize they were pregnant. Some women also aren't going to be reporting when they have a miscarriage, especially if it happens really early on. Now, the risk of having a miscarriage is estimated to be about 20% after your first miscarriage. It's estimated to be about 28% after having 2 miscarriages and estimated to be about 43% after having 3 miscarriages. However, these stats, we need to consider what is happening in between the miscarriages. Are these women who are being included in these stats, are they being given support to help them either address the cause of the miscarriages or just overall improve their fertility? And most of the time, the answer is no. A lot of times when women have a miscarriage, they are just told to try again. And yes, sometimes their OB might do some genetic testing. They might, do a few other tests, which we'll talk about, but they're really not getting a comprehensive workup. They're kind of just getting the bare bones testing. And if that comes back normal, they're usually told, well, miscarriages happen, just keep trying. And there really is so much that can be done after a miscarriage and before trying to get pregnant in general to help improve fertility and prevent against miscarriage. So although these stats, if you've ever had a miscarriage, maybe you've looked up, what's the risk or what are the chances of me having another miscarriage? These numbers can feel defeating, especially if you've had multiple miscarriages. But you have to remember that most of these women that are being included in the studies that are pulling these stats are not really getting good fertility support. So I want to start just kind of going over some causes of miscarriage because, that is a big thing I get asked when women come to me after they've had one or multiple miscarriages. They want to say, why am I having these miscarriages? I want to find out why before I become pregnant again. And it's not always black and white. We can't always find a clear-cut answer, but there are tests that we can do to kind of just check off the boxes and say, okay, we know it wasn't related to this. We know it's not related to that. So common causes of miscarriage, genetic abnormalities. I'm sure that you have, heard this one, especially in that 6 to 8 week mark. We often see genetic abnormalities contributing to miscarriage around that time. And that, there's a little bit you can do around that, but that's a lot of times out of our control. And that one can be a really hard one to want to accept because it can feel like, okay, well, if that was the cause of my miscarriage this time, who's to say it won't be next time? Now, some things that we can test for and control a little bit more, one would be illness and infection. So STIs are a really common one. I think it's really important to get STI testing done if you've had a miscarriage, even if you are thinking, my partner is 100% loyal to me. I know they are. You could potentially have an STI lingering from years ago that maybe potentially could be causing inflammation in your reproductive tract. So it's good to just get STI testing done. Things like COVID. So, I've heard from a lot of women that they got pregnant and they got COVID a few weeks later and then miscarried. So any sort of major infection, illness that's going to be stressing the body, that can potentially lead to miscarriage. Another common cause is autoimmune disease. So this is essentially when our immune system picks something in our body and it creates an immune response to it and attacks it. So one really common example would be Hashimoto's, which is when our immune system attacks our thyroid. And the reason for this is if our immune system is making these antibodies that essentially attack our own self, our own tissue, those same antibodies may also attack the embryo that is growing. So for somebody with Hashimoto's, yes, we're going to be looking at, are your thyroid hormones in a good place to support the growth of your baby? But we also want to consider, how can we reduce your antibody level so that we're not having this inflammation immune type attack. Luteal phase defect is probably the most common cause of miscarriage that I see in my practice. And that is essentially when progesterone levels are too low. So progesterone is a hormone that is made when we ovulate, and it is continued to be made until we get our period. Now, if you're somebody who has really bad PMS symptoms, if you notice that you spot a few days leading up to your period, or maybe you're spotting in between periods, or if your cycles are really short, so maybe you get your period every 19 days, 20 days, those are all signs that you may have low progesterone. Progesterone is the most important hormone during the first trimester of pregnancy. It's known as the pregnancy hormone. And that's because when we're not pregnant, progesterone will be produced for 2 weeks. Again, starting at ovulation, it's produced for 2 weeks. And then once progesterone levels start to drop, our body senses, okay, progesterone levels are dropping, a pregnancy hasn't taken place, it's time to have our period. Now, if we do get pregnant and our body is not able to make progesterone to the level that we need it, then our body is going to think, okay, progesterone levels are dropping, we must not be pregnant. And it's going to start to break down the lining of the uterus, which is where that embryo has implanted, and we're going to lose that pregnancy. So during the first trimester of pregnancy, there is something called a corpus luteum. The corpus luteum is essentially the sac in our ovary that used to hold the egg. So when we ovulate, the egg is released from the sac. The egg travels from the ovary down the fallopian tube into the uterus. It meets the sperm and implantation happens. That sac that's left over is known as the corpus luteum, and that starts making progesterone. Now that can kind of communicate with the uterus, and it can sense, okay, a pregnancy has taken place, so I should continue to make progesterone. And the corpus luteum is responsible for making progesterone until week 10 of the pregnancy, which is when the placenta has grown enough and developed enough to take over making progesterone to maintain the pregnancy. So that is why low progesterone during the first trimester, we will see miscarriages related to that low progesterone before week 10. And that is why I recommend testing progesterone right away. And if you are my patient and you've ever sent me I got a positive pregnancy test message, you know that I say, okay, call your OB, let's get progesterone tested as soon as possible so that we can make sure it's in a good place now. And ideally, and it is possible to have a healthy pregnancy with lower levels, but ideally I want to see progesterone over 16, especially if there is a history of miscarriage. Can women have a healthy pregnancy with progesterone over 10, 11, 12, around that number? Yes, absolutely. But the chances of miscarriage reduce a lot more once progesterone is over 16. We absolutely, bare minimum, want progesterone over 10. And even conventional medicine will say that as well. They will often prescribe progesterone during the first trimester if your progesterone is under 10. Now, your OB is not going to, by default, test your progesterone right when you become pregnant. So your progesterone could be low, but your doctor has no idea. And it could be 7, 8, 9. And while, yes, your conventional doctor would say, okay, you qualify for taking progesterone, if they're not testing it, there's no way to know. So that is something I recommend testing right away. And especially if you have a history of miscarriage, it's something that I like to test during your cycle, kind of in between. So if somebody comes to me and maybe they had a miscarriage 6 months ago and they are wanting to do a few months of support before trying to get pregnant again, I'll say, okay, has your progesterone been tested in the past? Yes or no? And then from there, we'll test their progesterone every month, maybe every other month, just to get a ballpark idea of where it's at in their cycle normally. So then we know, if your progesterone is a little bit on the lower end during your cycle, then we're really going to have to be on top of testing it and supplementing once you become pregnant. Now, there are supplements that can help support progesterone production, like vitamin B6 is a really amazing one, evening primrose oil. And that is all great when you're doing preconception support. But if your progesterone levels are low during that first trimester and you have a history of miscarriage, we're not going to be messing around with the natural support. We're going to be going straight to supplementing with a progesterone prescription, which is something that your OB would provide you. Now, many women will only have to take progesterone during the first trimester. Once the placenta is developed enough, it will take it over. But some women, and this especially applies if you've had recurrent miscarriages, some women may need to take progesterone during their entire pregnancy. And that's something that you would talk to your OB about. Okay, kind of veered off course a little bit there, but let's get back to the causes of miscarriage. So along with luteal phase defect, we have ectopic pregnancies. This one, I don't quite count it in the same category as having a miscarriage for a viable pregnancy, because an ectopic pregnancy is not going to be viable. This is essentially when implantation happens in the fallopian tube. So yes, on a blood test, you're going to be getting some of those positive pregnancy markers like the positive HCG, maybe the slightly higher progesterone levels, but there's no way for this embryo to grow in the fallopian tube, and you're going to start to have some pain, and hopefully they catch it before a fallopian tube ruptures. For some women, that is not the case, but that would be considered a miscarriage as well. And then we have structural issues. So things like fibroids or polyps growing in the uterus or potentially positioning of the uterus can all play a role with how implantation takes place and how the placenta develops. Now, if you're listening to this and you have fibroids or polyps, or if your uterus is slightly tilted in your pelvic floor, it's not a guarantee that this is going to impact your fertility. Oftentimes it doesn't, but if you're somebody who's having recurring miscarriages, then it's something to consider. The last thing on my kind of list of causes here, environmental toxins. So smoking, excessive alcohol consumption, even women who work in hair salons who are around those toxins, and they're breathing it in, they're touching all the hair dye all day, that can impact our fertility as well. So when we have a miscarriage, first I want to say, I know there can be a lot of fear during the first few weeks of knowing you're pregnant because of that fear of miscarriage. Spotting during those first few weeks, especially during weeks 3 through 5, can be normal. So when you see spotting, I think absolutely reach out to your OB, but don't panic. Don't assume that you are miscarrying. Just, get the workup, get the support you need while trying to remain calm. Now, signs that you may be miscarrying, definitely heavy bleeding, cramping or severe pain, back pain, or disappearance of pregnancy symptoms. So if you previously had nausea, breast tenderness, and suddenly around week 7 or 8, that goes away, that may be a sign potentially that you're miscarrying. So all of these signs are reasons to reach out to your OB. When you miscarry, it is normal to bleed for up to 2 weeks after miscarrying. And you definitely want to consider, how much blood you're losing, because that is going to play a role in your recovery after a miscarriage too, which we'll talk about. Now, I often get asked, I had a miscarriage recently. How soon is too soon to try again? And technically, biologically, you could potentially get pregnant immediately after having a miscarriage. Typically, conventional medical doctors will recommend having at least one period before trying to conceive again, just kind of giving your body one cycle to get back on track. I typically recommend longer because, if a miscarriage happened and it's not really clear why, I typically don't recommend just jumping right back into another pregnancy without doing some investigation and some work to make sure that we are doing everything possible to prevent this from happening again. So if somebody asks, how soon is too soon, I usually say, maybe give me 3 months, that will give us time to get all the blood tests done. It'll give us time to improve any hormone imbalances, also help to really build back up your body too. If you have a miscarriage, especially later in first trimester or even early in second trimester, that was, a considerable amount of time where your body was going through hormone changes. So it's going to need some time to kind of get back to baseline as well. Now, some general steps to take after having a miscarriage. Number one, probably the most important, is emotional support. So making sure that you are taking time to kind of process what you've been through, to grieve your loss, maybe considering, seeing your therapist or establishing therapy to kind of work through those emotions, because moving into a potential other pregnancy, you don't want to be carrying that stress and fear and anxiety with you into your next pregnancy. So giving yourself time to work through that before trying to conceive again. Now, from a nutrition standpoint, definitely just trying to nourish your body. Like I mentioned, your hormones had been shifting throughout pregnancy, and then you go through a miscarriage, and it's kind of similar to a lesser degree of being postpartum, where your body is kind of getting back to its balanced state. So something super simple, and I talk about this all the time, is just making sure you're having a nice balanced breakfast. My hormone balancing smoothie recipe is something super simple, especially if you tend not to have an appetite. As your hormones are shifting, you may find that you're not super hungry in the morning. So making something like a smoothie, you can make that in the morning, sip on it for breakfast and lunch, and just kind of work through it throughout the day. But at least you're getting in that protein, fat, fiber, some good antioxidants through the berries. So I'll include the link for the hormone balancing smoothie in the show notes if you want to take a look at that. Also considering iron-rich foods. So especially if you had heavy bleeding or long bleeding during your miscarriage, it's going to be important to replenish those iron stores. So foods like leafy greens, red meat, beans, pumpkin seeds can help replenish those. In terms of supplements, staying on a prenatal, typically at this point, you will have been on a prenatal through the first few weeks of pregnancy. I usually recommend staying on it because essentially it's like a juiced up multivitamin. And especially if you are, working towards trying to conceive again, the prenatal should just stay on board, even if it's not something that you'd been taking previously before becoming pregnant. And then also considering an iron supplement. Again, if you had a lot of blood loss, if you tend to be iron deficient, if getting those iron-rich foods in your diet is a struggle, then taking a supplement might be necessary. A common question I also get asked is, when is it okay to go back into exercise or movement? And really that's, once you're feeling up for it, both physically and emotionally. Again, it'll partially depend on how far along were you in your pregnancy when you had your miscarriage and how much blood loss did you have. But otherwise, typically pretty soon after, it's okay to start to get back into movement. Now, I mentioned this a little bit earlier in the episode, but my biggest kind of hopefully take home message here is, if you have a miscarriage and your doctor says, just go try again, and if you want to accept that, that is completely up to you. But my recommendation is to work with somebody to just kind of check off all the boxes and make sure that you are set up in a position where you're going into this next pregnancy in a better physical place than you did with the last one. And again, sometimes miscarriages are just related to genetics. Sometimes that is completely out of our control. You might have one miscarriage, the next pregnancy goes very well, no complications, and it's just that. But I think for having the peace of mind and just making sure that you are setting yourself up for success, it's important to not just blindly try to conceive again. So when patients come to me and they are asking, for support post miscarriage, one place we start is lab work. And sometimes they come to me and they've had some good blood work done with their OB. Usually it's not as comprehensive as I like to see, but it's a good starting place. So one thing we're looking at is autoimmune testing. So definitely looking for Hashimoto's, looking at thyroid markers, thyroid antibodies. But we also want to look at something called antiphospholipid syndrome. And this is essentially when antibodies cause microclots, or blood to have small blood clots, and that can lead to miscarriage. So it's something that is easy to test for, but isn't always being tested for after miscarriage, but it really should be. Also considering a hormone panel. So I love the Dutch test, which is a urine hormone panel you collect at home. But I would say my top 2 hormones to test, one would be progesterone. So you want to make sure you're testing that on cycle day 21 or 6 days after ovulation. So if you tend to ovulate a little bit earlier or a little bit later, aim to test your progesterone 6 days later. That way you can see, if your progesterone's coming back at 3 or 4, that's a good indicator that your progesterone was struggling during your pregnancy. We also want to look at a hormone called DHEAS. This can be a good indicator of egg quality. So maybe we want to do more support around egg health if that number is really low. So along with autoimmune testing, hormone testing, looking at vitamins and minerals. So looking for deficiencies in iron, B12, B6, vitamin D, folate. All these things are very, very fixable. We just need to know what your levels are at. We don't want to just super dose you vitamin D, assuming that you're low if you're not. But getting all the information, and then you can see, okay, I don't have to worry about hormones. I don't have to worry about autoimmunity, but I do have to worry about my nutrition and my vitamins and minerals. It just gives you something to really focus on. Also considering blood sugar levels, especially if you tend to have a family history of insulin resistance or diabetes, but pre-diabetes and diabetes can increase risk of miscarriage. So it's important that you're getting your blood sugar under control. Genetic testing is something that your OB might suggest, especially if you've had 2 or more miscarriages. And this will look at genetic testing for both partners. And then looking at imaging of the uterus. So this is going to assess for any sort of structural concerns that may have contributed to a miscarriage. And again, it's something to just kind of check the box off and then just know, okay, I don't have any fibroids or polyps. My uterus is looking good. So I know it's likely not a structural issue. And then lastly is a semen analysis. And this is a step that I think is often overlooked. I always have women coming to me willing to do, all the things to support their fertility, and their partners are just kind of living their life on the corner. So I usually recommend doing a semen analysis if you've had a miscarriage, because that, it takes 2 to make a baby. It takes the egg and the sperm. So just looking at, the shape and the movement of the sperm to make sure that it's the highest quality possible. And fortunately, as far as supporting men's fertility, it's much more straightforward than women. So even if things do come back abnormal, it's not too complicated to address it. But in general, I recommend doing 3 months of preconception support after a miscarriage before going right into trying again. Now, I have had women who have come to me, they had a miscarriage, we start working together, and then a month or 2 later, they get pregnant again, and then they kind of get stressed and they think, oh, I didn't wait the 3 months, and that's okay. At that point, we've started the blood work, we've started to make some good foundational changes. It's not the end of the world, but if you're asking for in a perfect picture, what would I recommend? I'd recommend 3 months of preconception support before trying again. 85% of women who experience a miscarriage will have a healthy full-term pregnancy afterwards. So don't just assume that one miscarriage is going to be your fate forever, but do work with somebody who's willing to do the work and ask the questions to figure out why this happened. And if the why can't be discovered, at least somebody who's going to say, okay, moving forward, we have gotten your body in the best place possible to have a healthy pregnancy. And right now, we can't see any reason why a healthy pregnancy shouldn't be possible for you this time around. Now, I do want to share an organization called SANS, which I will link in the show notes. And this is basically support for miscarriage and stillbirth. So if you have had a miscarriage and are looking for support, this is an independent organization that helps with that. All right, that is all I have for you today. I hope that was helpful. I hope, that you don't feel overwhelmed. Maybe if you've had a miscarriage and you haven't taken these steps, that's okay. I'm just here to share the information and hopefully get the wheels turning a little bit on things that maybe you can ask your OB about next time you're in the office with her, or maybe things that have kind of stood out in the past that maybe have been dismissed. Like maybe your progesterone has been a little bit low, but your OB said it was no big deal. Well, this is maybe encouragement to kind of dive deeper into that and maybe ask them more about that, or find a provider who's going to look at your labs and consider your fertility history through a different lens. All right. Thank you so much for joining me today. If you have any questions or you'd like to connect, you can always DM me on Instagram at Dr. Danielle _ND or shoot me an email. The email will be in the show notes. Have a wonderful week, and I will see you on Friday for our Friday Chats episode.